If the input area is not filled with element or salt enough, the symptom became noticeably worse. The area turned red and increased itching. Regarding the farm management, start with nutritional management. Wasana was feed two types of feed. The raw feed was strong, molasses, and napier grass, which was provide aluminum. The content test was MD 555P, containing 40% crude protein, giving at 3 kg per day. She was also supplemented with a premix about 2 tablespoons per day. Drinking water was available at the time. Next is housing management. Wasana is kept in an open pen with a concrete floor. Measuring 6 by 3 square meter and insect net are installed on the pen to prevent insect at night. And the last one is helmet made. Wasana has no previous history of illness except for her current skin condition. She is regularly vaccinated for hemorrhagic septicemia and foot and mouth disease, given every 4 months with albendazole.
After history taking, we perform a physical examination. Our findings were within normal limits, except for the skin, which showed some abnormalities. The skin abnormalities were found on our forelimbs, ventral abdomen, thorax, and neck. The problem list we found hypermelis, crest scale, and lacanification on the ventral cervical area, thorax, abdomen, and our forelimbs. The owner reported the preliminary score as 8 out of 10. Move on to the initial assessment. The first problem is crust scaling and lacanification. This represents chronic skin lesions which may result from ectoparasite infestation such as Sarcoptes KBI, lice infestation. Infectious causes including bacterial infections commonly found in ruminants such as dermatophilus or Staphylococcal pyoderma, fungal infections such as dermatophytosis, Paradifoliaceous, zinc deficiency. The second problem is bacterial causes by ectoparasite, bacterial or fungal infections, hypersensitivity or allergic reactions. For the initial plans includes collection of skin samples using Scotch tape technique, superficial skin scraping, triphogan, crust collection and red impression smear by collection for health evaluation.
After the sample collection, the following laboratory examination results were obtained. From spontaneous bacterial organisms were observed, showing a transparent arrangement pattern along with numerous dot-shaped bacteria in the background. For both superficial and deep skin scraping, no obvious ectoparasites or pathogens were found. The trichogram examination also revealed no obvious ectoparasite or pathogens were found attached to the hair shaft. A skin sample collected by the direct impression after removing the crust shows numerous oblate cells with no parasites or microorganisms detected. For the complete blood count, the abnormal finding decreased liver cell, hemoglobin, PTV, and MCSC value, while MCV was higher than the reference range. This indicates macrocytic hypochromic anemia. Additionally, hypochromasia through past and adequate platelet count were noted. While cell values were within the reference range. Biochemistry results showed abnormality including mildly elevated LST and low BUA.
According to the result and finding, the revised assessment of the problems is as follows. Starting with the first problem, crusting, scaling, and lichenification. These lesions are suspected to result from a dermatophilus congolensis infection based on the findings from the skin sample examination. Therefore, ectoparasitic, immune-mediated, and nutritional causes were considered less likely. Next, the second problem, pruritus. It's suspected to be caused by a dermatophilus congolensis infection based on the result of the skin sample examination. Therefore, ectoparasitic and hypersensitivity causes were considered less likely. From the complete blood count result showing macrocytic hypochromic anemia, which can arise from two main causes, decreased hemoglobin synthesis and nutritional deficiency. The cause related to decreased hemoglobin synthesis can be ruled out by liver disease through biochemistry result, myelodysplastic syndrome through complete blood count finding, and drug or toxin exposure through history taking, and nutritional deficiency. Vitamin B9 deficiency was considered less likely as ruminants capable of producing it through rumen microbes. From the biochemistry result, the abnormality found were low BUN, which can result from two causes: low protein intake and liver dysfunction. However, liver dysfunction can be ruled out as the liver enzyme level were only mildly elevated. And mildly elevated AST, which can occur due to stress, muscle damage, or hepatic disease. For muscle damage can be ruled out based on the normal physical examination finding, and hepatic disease is given less consideration since the AST elevation was only mild. So the revised problem list for this case is as hyperemia with crusting, scaling, and lichenification along with pruritus are likely caused by dermatophilus congolensis based on the Tram-Tag pattern from the Scott tape test. And the Tram-Tag pattern suggests dermatophilus congolensis causing chronic bacterial dermatitis. As for macrocytic hypochromic anemia, low BUN and mildly elevated AST, further investigation will be conducted to determine their underlying causes.
Therefore, the tentative diagnosis for this case is chronic bacterial dermatitis suspect dermatophilus congolensis infection. Moving on to the treatment plan on October 14, the first step was batting the buffalo and jelly remove the cast from the skin. A topical treatment with 4% coexident shampoo was started with a bathing schedule set for every alternate. After each bath, 1% povidone iodine spray was applied to the affected area. Systemic treatment was also provided. An antibiotic ceftiofur hydrochloride was administered at a dose of 2.2 mg per kilogram once daily intramuscular injection for 6 days. An anti-inflammatory drug, fulisin was also given at the same dose, 2.2 mg per kilogram once daily intramuscular injection for 4 days. In addition, antihistamine chlorpheniramine maleate was administered at a dose of 0.5 mg per kilogram intramuscular at a single injection on that day. And lastly, ivermectin was given a dose of 0.2 mg per kilogram subcutaneous at a single dose for internal parasite control. Next, moving on to the follow-up section. On day 3 and day 4 after treatment, the owner reported that the buffalo showed improvement. There was no bleeding at the site where the cut had been removed and no new cut had formed. However, one cut was still present on the ventral abdomen. The lesion of the skin and itching had also decreased. However, on 7th day after completing the prescribed medication, a follow-up call revealed that the animal condition had no improved and itching had increased. Next, further plan. The treatment should be continued for 2 weeks and follow the topical treatment with bathing every other day, ceftiofur hydrochloride for 2 weeks, chlorpheniramine maleate for 1 week, and supplement perchloroxam to support vitamin B complex and iron. Mineral supplement to improve skin and immune health. Prognosis for this case is good, improved within 14 days, full coverage within 1 month.
Move on to the discussion part. Let's take a closer look at dermatophilosis in ruminants. Dermatophilosis is a skin disease caused by the bacteria called Dermatophilus congolensis. The bacteria has a worldwide distribution, but outbreaks are most common in tropical and subtropical regions with warm and humid climates. These are the example of the country where outbreak in buffalo have been reported, including African continent, for example, in Zimbabwe or Ethiopia. For Asia continents, for example, in India, Nepal. But for Thailand, there are no reports of the disease in buffalo, but cases have been reported in cows. Next, let's explore the characteristics of causative agent Dermatophilus congolensis. Dermatophilus congolensis is a gram-positive non-acid fast-staining facultative anaerobic bacterium. It has 2 distinct morphological forms. The first form is filamentous hyphae. The hallmark appearance is a Tram-Tag pattern formed by a parallel chain of bacterial cells. And the second form is multi-cell spore, which appear in oval-shaped and flagellated spores. For the route of transmission, this bacteria can be transmitted through several routes. The first one is direct contact with the infected animals. The second one is indirect contact via the contaminated equipment, such as the grooming brushes. Or the mechanical transmission through living insects such as ticks and stable flies.
After the animal become infected, the cytokine show clinical signs in three stages. Stage 1. The hair starts to form in small clumps like pepper lesion. Stage 2. Hard crust begin to form on the surface of the skin. And stage 3. These crusts become thicker and raised, forming rod-like nodules. In addition, when the infection occurs around the carpus or the hog or coronate areas, it can lead to a condition known as strawberry foot rot. It is a type of proliferative dermatitis in which the skin becomes inflamed and take on an appearance similar to the surface of a strawberry. There are several methods for disease diagnosis, including cytology, that is commonly used in clinics, and bacterial culture, skin biopsy with cytopathology, molecular methods, and serology. Next, for the treatment, there are two main approaches by using topical treatment and systemic treatment. Before applying the topical treatment, it is important to remove the crust and infected material from the affected area. For topical treatment, we can use 2 to 4% chlorhexidine shampoo or lime sulfur, followed by 1% polyodolidine spray after bathing. And for systemic treatment, antibiotics are given to eliminate dermatophilus convalescence. And the best treatment outcome is achieved by combining both topical and systemic treatment together. For the control and prevention of this disease, proper management of the housing is essential. The pen should be kept clean and dry at all times. Infected animals should be isolated, and in severe cases, culling may be necessary to break the infection cycle. Ectoparasite control is also important to reduce transmission by insects. And lastly, nutritional management should include supplementation with vitamin A and zinc to help strengthen the skin and improve immunity. Finally, the causative agent of dermatophilosis can also be transmitted to humans. Therefore, veterinarians and anyone handling infected animals should always wear gloves when touching or treating suspected case, and hands should be washed with antiseptic soap after contact, as human infection usually occurs through direct contact with infected animals. And this is our reference. Thank you all advisors for your guidance along this station. And here is our member. Thank you everyone for listening. And if you have any questions, please don't hesitate to raise your hand.